So, but I love Michigan, and there's no question about whether or not I love Michigan. It's my home. It's I was raised in Michigan, and yeah, absolutely, I was raised in Michigan. 96,000 square miles. I'll tell you. Population of 10 million. Bordered by, what is it, Ohio, Indiana, Wisconsin, what, Minnesota? Five lakes, five Great Lakes, five lakes, and five rivers. Absolutely. 96,000 square miles. Michigan is just ripe for business. I think that, you know, over the years that Michigan had been slow. Michigan have been reluctant to embrace healthcare and technology as aggressive as it should have. And they've made some strides, but not as much as some other states. And, with the U.S. Census Bureau predicting that by 2030, some 20% of our population, or nearly 20% of our population, will be individuals ages 65 and older. And I mean, that the writing is on the wall, and that's enough for me right there. Those statistics are enough for me to really want to, push entrepreneurship, business ownership in the personal care arena. And Michigan has some great locations to put up personal care businesses. Southfield, Farmington, Dearborn, West Bloomfield, and Sterling Heights. And I'm not just talking about any group home, any adult foster care home. We're talking about the licensed environment where you're able to accommodate 6 individuals in the home. And really what dictates how many of that 6 you get in Michigan is the square footage of the rooms. So you need 80 square feet to get 1 adult and 130 square feet to get 2 adults, I believe. And the ranch style model is with open floor space, significantly open floor space areas is the best way to go. And we've put these together throughout Michigan. We work with some of the best of them and put together some of the best facilities. I was consultant for Joack American Homes and worked very closely with the late Josephine Akune early on, 2005, 2006, in developing some very, very good programs, Alzheimer's, dementia, case management, an HIV case management program out in Ann Arbor and Washington County, Ypsilanti area. Chris Warburton and with Hearthstone Communities, and Lijo Antoni with Walnut Creek Living in Macomb, Michigan. And we also put together Majestic Specialized Homes over in Southfield. A plethora of other homes. I really could go on and on with naming the facilities that we actually have put together. And these are some successful businesses. And we do a very good business model. I'm Ernest Flagg, President and CEO of Nursing and Behavioral Health Services, and this has been my line of work for some 20 years, and putting together, starting, managing, and marketing personal care businesses. And I would love for you to give us a call, because we make business dreams a reality. Okay, welcome. My name is Ernest Flagg. I'm with Nursing and Behavioral Health Services. Our parent organization is Flagg and Associates. We are approved trainers for the state of Michigan, for Laura. You will find our Flag and Associates, our parent organization, listed there as approved trainers. Um, I am charged with doing another video on the physical plant. These are requirements that the state of Michigan, the licensing consultant, will be looking at when they come into your home, um, you know, to approve your facility. And they will expect these things to be done. They will expect a lot of things to be done. And so, and before they even license your home, their mindset, you know, their mindset is that before they need to have all the safe health. Okay, welcome. My name is Ernest Flagg. I am charged once again with another training. I am with Nursing and Behavioral Health Services. Our parent organization is Flagg and Associates, and we are program specialists. We actually license personal care businesses nationally, adult foster care homes, home care, home health agencies, durable medical equipment supply companies, nursing homes. We actually are private consultants. Our website is nbhsllc.com. And again, our parent organization is Flagg and Associates. We are approved trainers for the state of Michigan for Laura. And if you go over to Laura website under requested trainings, you can get individual trainings from us as well, and administrative trainings for the your administrator. And here we are right here. This is again our parent organization. If you want to get your administrator training, which is necessary, and as well your direct care worker training, we actually provide that training for you. It's necessary if you're going to license a facility in the state of Michigan. And we are able to, part of our trainings are on, many of our trainings are online, but we're also able to come directly to you and perform that administrator training, direct care worker training, or medication training as well. And so your call. I mean, we would love to drive your project, get your group home licensed and drive it from start to finish. We've done some very, very remarkable programs there in the state of Michigan. We've worked with many great people. Over the years, 20 years at it, we've put together hundreds of facilities. And we've worked with some great people. Joac American Homes, I worked personally with Josephina Kune when she was alive. We put together, wrote some remarkable programs for her over there in Ann Arbor. We worked with, put together a project, Hearthstone Communities over at Sterling Heights, and as well Walnut Creek Living over in Macomb, Michigan. These are some very, very wonderful projects that we have put together, and we do. We've never not licensed a facility, and we're good at what it is we do. This particular video I'm going to talk about, this is going to be connected with another video, but two of the most essential pieces that need to be known. And the other video is on the physical plant requirements, but this particular video is on the home licensee, licensee designee, and administrator, and members of the household. I'm not really going to focus on the members of the household as much, too much, if I even talk about it at all. But I want to talk about this. You need to know whether you're going to be the owner of the home, the administrator, or the licensee designee. You're going to need these. You're going to need this particular. Your administrator will need certain training. Now, the licensee of a home will be the corporation or the LLC. Okay, and so keep in mind, if it's a corporation, there's a board attached to it, a governing board or board of directors. And if it's an LLC, it would be organizing members. Um, and so that would be the licensee. Licensee actually also can be an individual, but we set up companies and we do not set up individual group homes. We can help you and guide you, but the bulk of our business is people setting up companies. So, and then up below the licensee would be the licensee designee. That's the person that's connected to the corporation. Below the licensee designee will be then the administrator. Below the administrator will be the nurse or agency nurse or site manager, and below the site manager would be the direct care workers or direct support professionals working in the group homes with direct contact to the resident population being served. If you are an administrator of a facility, if you are the licensee, you will still need to have direct care worker certification or training if you're going to have direct contact with the residents or the population being served. So I need to say that much. And that being said, I'm going to move into talking about some general requirements that the state is going to be looking for when you file that application. Administrative and being fiscally sound is one characteristic, one requirement. And so that administrator or that owner or that entity, you will have to have money in the bank account of the company, and that should be in the area of $3,000-$5,000 to show that you have some money to fall back on, to keep the lights on, to keep the gas on, to keep the residents fed, to keep the house note, paid, and to keep the wheels turning of that business. All right. So that's how you demonstrate fiscal solvency in terms of here. That's one way of demonstrating it. Look at that other section, 313-3. You got licensing record clearance, good moral character, and suitability. You will have to demonstrate that you are, and they're going to run that background check, that you are of good moral character and you can run this particular business and you don't have criminal record, and anything come back on that criminal record will be challenged and will be looked at and weighed. So it doesn't automatically bar you from being an administrator. It doesn't automatically bar your administrator, but at the same time, it's going to be looked at. Now, some things that will likely go against you is if that offense is an aggression, if it's an aggression toward another human being, if it is recent, if it is of abuse and neglect nature, if your name is on one of those registries, and you know one of those registries, absolutely, that sex offender registry or that abuse and neglect registry, or you're going to have some problems, okay? You're going to have some real problems. And also, if it comes back, you got a felony, you're going to have a problem. Or your administrator is going to have a problem. And you're going to have to do some other things to really deal with that. Physician health statement. That administrator and the direct care workers will have to have a physical. And it's going to have to come back where you have no restrictions that will prevent you from being the administrator of this particular facility or being a direct care worker. And I'm just covering that direct care worker piece because it's applicable, but we're talking about the physical health statement that the administrators is going to have to submit. The administrator and licensee designee or owner will have to submit when they're making the application to the state to get a group home license. TB test results are going to have to be relevant as well. And that does say physician health statement, so a nurse cannot do it. I'm talking about it because people have brought them back with the nurse or nurse practitioner having completed. Now, a nurse practitioner can initiate it, but a physician's signature need to be on it unless something has changed. Competency requirements. They're going to require that administrator have 1 year of experience with that population. and also training in the area of nutrition, first aid, CPR, and as well, safety, fire prevention, fiscal and administrative management, and to the populations that they'll be serving. So they're going to have some training, and that advanced training is something we can provide. We can also provide the direct care worker training, prevention and containment of communicable disease, behavioral intervention if it's applicable. Now our administrative training covers all this, and you're going to get it anyway. But at the same, they say if applicable here for the behavioral intervention training, because some populations it may not be required. But if you're going to be dealing with a population in which the acuity is high, it will be reasonable for a consultant to request this of you. In addition to that, the training that the administrator have must be approved by the state of Michigan. So keep in mind, and it's behoove the owner and administrator to make sure that training is approved, because you don't want any glitches. Annually, the administrator will require 16 hours in those particular areas, so it has to be renewed. Your direct care worker will also have to have some specific updates annually, and minimally it's in the area of the medication update, recipient rights, and the population being served. And it should also be in the area of prevention and containment of communicable diseases. I believe the first aid is 2 years, and maybe the CPR is 1. So don't quote me on that, but look at those closely, because that employee record needs to be maintained. The direct care worker and the administrator record needs to be maintained properly annually. And we'll get into that down the line. But understanding this information is very critical in filing an application with the state of Michigan and you also need a home. You need these requirements for the administrator, but you also need that home. Some states you don't need a home right away to apply for licensure, because they want to see your program material first. But in Michigan, they don't want to see, you got to have a home. You got to have your program material put together, and you also need to have your licensee and administrator need to have their credentials proper and on deck and in advance of applying. And so this concludes this particular video. I want to scroll through here and see if there's anything else I want to add. When you do apply, I just want to say that you're going to definitely need at least one direct care worker record complete, and your administrative record will have to be thorough, and you at least need to have one fully complete direct care worker on staff and have their file there ready for review in advance of the state, coming out, once the state come out as well. And this concludes this particular video. Again, my name is Ernest Flagg. Our links are below. Like us, love us, keep us in mind, and retain us to get your business together, to get your adult foster care home put together from start to finish. Again, we manage all program material. We design all our program material. We can assist you in that whole development process and put together some really, really nice programs for you, whether you want to deal with dementia, Alzheimer's, Parkinson's, medically fragile, traumatic brain injured, if you want to deal with Alzheimer's, if you want to deal with, hospice populations, or even children's group homes, which is totally away from the adults, but children group home. Keep us in mind. Visit our website at nbhsllc.com, and